Good day everyone, my name is Shakari Reyes from BSN 12D and today I'm going to perform the newborn cardiopulmonary resuscitation. So since it's a newborn, we need to determine first the baby's Apgar score, which is test done after 1 minute and 5 minutes after birth. And stimulate the baby's response through tapping the baby's shoulder, rubbing the soles and calling out the name loudly. Baby, baby, are you okay? Baby, baby. And if the baby has no response, immediately call out the attention for help to activate the code blue or doctors quick. And after that is open the baby's airway and suction the mouth and nose using the suction valve. And if the baby is still unresponsive, this time is I have to perform a positive pressure ventilation or PPV using pediatric valve mask. BVM, which is the non-invasive method, then I have to make sure that the BVM is attached to the oxygen cylinder with 100% oxygen, then cover the entire mouth and nose with BVM and allow 30 seconds of ventilation for 40 to 60 breaths per minute, and making sure to check the chest rise and each bagging, and in doing this successfully will help the baby's survival rate. Then have someone that will attach to the cardiac monitor and pulse oximeter to measure the baby's oxygen saturation. And if the baby's condition still doesn't improve after performing PPV, we'll have to start giving gentle chest compression using 2 to 3 fingers technique or 2 thumb fingers like this. And so give 30 chest compressions within 18 seconds or less, and each compression should be at least 1/3 depth of the chest to successfully reach the heart while minimizing the pressures. Giving chest compressions 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Giving 2 risky breaths. 1, 2. After 4 cycles up and the baby heart rate is still less than 60, then we'll switch roles to another skewer and keep on doing chest compressions, assist intubation and giving meds, and discontinue only if the resuscitation after 20 minutes that the baby's heart rate remains unresponsive. So during the 5th set of compression, roles are switched to the second skewer and you will be giving 2 risky breaths after they perform 30 chest compression. Second skewer, giving chest compression 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. First skewer, giving 2 risky breaths. 1, 2. After that, both skewers should issue high quality of CPR by switching roles, and this time, the rescuer should get 15 within 9 seconds or less using the 2 thumb fingers technique for 2 cycles, while the first rescuer give 2 risky breaths each after cycle. Second rescuer give 15 chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So now the first skewer will be giving 2 risky breaths after 2 cycles. The 2 restoration is switched roles again. And this time, the first skewer will be giving 15 chest compression and the second skewer will be the one giving 2 risky breaths. First skewer giving 15 chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Second skewer giving 2 risky breaths. 1, 2. So, if the baby's heart rate is already more than 800, we'll have to discontinue the compression and do post-resuscitative care and the procedure, assessment done, and the responses to the treatment and medication given to the patient. The next procedure is I am going to perform the pediatric resuscitation for a child. This procedure is done when the child's heartbeat or breathing has stopped, and also make sure that the scene is safe by checking the environment up, down, left, and right. Now, the scene is safe. Then, check for breathing for up to 10 seconds using the look, listen, and feel method. Then gently squeeze the shoulders while calling out your name. Hey, hey, are you okay? Hey, hey, are you okay? So, if there's no response, ask for someone to call for an emergency and back to the patient right away. Hey, you, in Whitehurst, call 911. There's a patient here in need of help. Now, in neutral position, check for the child's pulse at the inner arm, between the shoulder and the elbow, and no more than 10 seconds. And if no pulse, immediately give 30 chest compression and follow the 2 rescue breath. Checking for pulse, no pulse, giving 30 chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Giving 2 rescue breaths. 1, 2. Next is check for the area if there is some obstruction for airway. Checking for airway. No obstruction found. Next is check for breathing for up to 10 seconds using the look, listen, and feel method. To do this is place your ear on top of the patient's airway while looking directly to the chest area and listening over their mouth and nose breathing. Checking for breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Still no breathing. Giving 2 rescue breaths. 1, 2. Checking the circulation. Pulse not found. So for the children, place one hand at the center of the chest, just below the nipple, and give 30 chest compression with 1/3 depth of the chest. Then continue for 5 cycles and 2 rescue breaths every after cycle. Giving 30 chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Giving 2 rescue breaths. 1, 2. After 1 minute of CPR, pause and check for the patient sign. Checking for pulse. Pulse found. So, if the pulse found, discontinue giving CPR and position the child in a recovered position, lying on their left side, where their arm supporting and supporting their head. And after that is document the time started and the time ended. The next procedure is I am going to perform the CPR for adult patient and also make sure that the scene is safe by checking the environment up, down, left, and right. The scene is safe. Then gently squeeze the shoulders while calling out your name. Ma, are you okay? Ma, are you okay? So if there's no response, ask for someone for an emergency and back to the patient right away. Help! You in Whitehurst, call 911 and bring AED. I have patient here need help. least and give 30 chest compression with no more than 18 seconds. And each compression should be at least 1/3 that of the chest to successfully reach the heart while minimizing the rib pressures. Giving 30 chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Giving 2 rescue breaths. 1, 2. Then using an AED or automated external defibrillator. When you already have it, first is power the AED. Then attach them to the person's chest and make sure that the pads do not touch each other. And stay clear for analysis and making sure that no one is touching the patient. So AED will check the heart rhythm. So if the shock is needed, and resume to giving CPR. Now, loudly shout clear to safely deliver the shock and making sure that no one is touching the patient before pushing the shock button. Then, immediately give CPR. Clear. Giving 30 chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Giving 2 rescue breaths. 1, 2. So, with the 2 rescuer teams, switch roles every 2 minutes or every after 5 cycles. This will allow yourself and your partner to take time alternatively, rest from giving compressions, which will lead to fatigue if done for long periods. Now, check for pulse. Pulse are found. So, if the pulse is found, assist the patient recover position with their left arm over their head to support and assist them into the left side. And after giving CPR, do pulse resuscitate